Ethics are very, very important in reporting, because what newspapers and magazines are setting themselves up are giving information to the public, and the public should have confidence in the quality of that information and the means by which it's been obtained. And the PCC enforces a specific code of practice that deals with several branches of ethics. But I think if you accept the fact that in a healthy society there should be a degree of free circulation of information, there has to be checks on that, and those checks have to be responsible journalism, and the code of practice is one way of seeking to ensure responsible journalism. So I would say ethics has to be at the centre of journalism if it's to be credible. There's court reporting when issues to do with HIV come out in court cases. There's a very small number of those, but confusion about the law in terms of transmission of HIV sometimes causes problems. I think it's the sweeping broad references sometimes. You get stories about other issues and a brief tangential reference to HIV, and because it's done quickly it might be subbed later on. What is quite a clear and complex situation is oversimplified, and which can lead to distortion. I think the use of terminology is very, very important. The idea of HIV as a killer disease, as a sort of offhand remark, we've seen examples of that. How it can be transmitted, again, sometimes offhand remarks, sometimes direct quotes from individuals who aren't in full possession of the facts. Those are the type of areas, I think, where the accuracy is particularly challenged and has been challenged using the PCC. The first clause of the code is accuracy. Newspapers must take care not to produce inaccurate, misleading or distorted material. So that goes right to the heart of what we've been talking about. Journalists, when they write the stories, and editors, when they publish them, have got to take care about the quality of the information. Generally speaking, also, anything to do with a person's illness, to do with their health, has a quality of privacy about it. So people should not be, and are very, very much the case, not outed as suffering a particular illness unless they want to talk about it. And I think that's a really important area, that health issues are private unless there's a very, very good reason to consider it otherwise.